Welcome back. So Wits University, in collaboration with the University of Oxford and the Oxford Jenner Institute, will roll out 2 more coronavirus vaccine trials in South Africa. Around 2,000 volunteers will be screened and then given either the vaccine or a placebo. This follows the June launch of the first COVID-19 vaccine to be tested on the continent. The South African Medical Research Council say that the trial of the Johnson & Johnson product and Novavax, I'm not even going to go into the names, will begin in South Africa next month. Professor Linda-Gail Bekker from the SAMRC joins us to discuss these 2 new vaccine trials in the country, as well as other issues around vaccines. Good to have you. Thanks so much for joining us.
Real pleasure. That's just to correct, from the Desmond Tutu HIV Centre, not the MRC, but otherwise happy to be here.
Great.
No worries.
Big apologies on that one. We'll certainly sort that out for you. Please accept our apologies. Let's get into the nitty-gritty. What exactly are the 2 vaccines that I was talking about, the trial vaccines, and do we have any idea yet as to how far we are with these trials?
Yes, so as you say, there are 3 trials that are sort of coming our way. The one is the chimp ad vaccine from Oxford, which is already in the field. That's a phase 2 underway in the country, which means we're really looking at safety and reactogenicity. Then Novavax is coming, which is an interesting vaccine. It's a protein vaccine that will also be going into phase 2. Again, safety and reactogenicity. And then very exciting, Johnson & Johnson's product, which is a vaccine based on their Ad26 vector vaccine, will be coming to us probably in the next month or 2. And that will be part of a phase 3. So really looking to see whether the vaccine can prevent or ameliorate the effect of COVID-19 disease in South Africans.
Yeah.
So a lot of work for us ahead.
Yeah, indeed there is. Now, what actually is the difference between these new vaccine trials, the one that was launched in June, which we spoke about, and now what we're going to be doing now?
So when we develop vaccines, we go through a series of phases, phase 1 all the way through to licensure. So the 2 of them are looking, as I say, at safety, so earlier in production. One of them actually a licensure trial. And all of this is to figure out, do these products actually either prevent or reduce the impact of the disease on individuals. They're using different kinds of platforms. So they're all directed at COVID-19, but based on different kinds of vaccine structures, all the way from proteins through to using other viruses that are not harmful to human beings. So on the one hand, chimp adenovirus, the other one Ad26, which causes common cold, but doesn't cause severe disease.
Yeah. I'm seeing some of the people that have signed up and the volunteers that have actually signed up. I'm reading here that even Professor Glenda Gray has signed up for this. She had her jab on the 11th of August, and a whole host of other South Africans as well. Where are these South Africans that are participating in it, and how will the placebo and trial vaccine actually be monitored, administered, the process through this?
Right. So this is these vaccine trials are run by professionally organized clinical research sites. So they have very careful, mechanisms in place to make sure that the right people get the right vaccine. This is in a randomized fashion. It's very important that all the processes are really excellent to ensure that the data we get at the end of the day is reliable. Secondly, all of the research sites are approved by our regulatory agency, SAPRA. And thirdly, all of the protocols are reviewed by ethics committees affiliated to all of the research sites. So there's a lot of checks and balances before we actually even get to giving a jab. And then, of course, we call on volunteers. They are ordinary South Africans who are in hotspot areas or places where COVID is being transmitted at the moment. So they're at risk. And then they have to be fully informed. They need to understand that they may fall into the arm of the placebo, or they may fall into the arm of the active ingredient, which, remember, is experimental at this stage. We don't know if it will work. So all those important steps need to be in place before we actually enroll anybody into the trial.
Yeah. Now, obviously, there's, like you say, there's a process in these vaccine trials. From history and from having a look at different vaccines that obviously science has advanced, we know this, but there are certain steps that have to be taken and time has to be spent on developing these and watching and monitoring and, you know, going first in animals and, you know, obviously I'm not the expert in this, but one can assume this does not happen overnight. So there is such a race taking place in the world to get this vaccine. The fear that shortcuts will be taken, I can imagine this is a reality.
Yeah, I think, you know, it's absolutely right that the urgency is upon all of us. You know, we're feeling the pressure of using non-biomedical interventions such as physical distancing, the lockdowns. This is difficult to maintain. So there's no doubt finding a vaccine is really critical for the world. And there's urgency because the pandemic is obviously right here amidst us. However, whilst we can speed up some aspects, there are some aspects of this process that cannot be shortcutted. It has to be followed through. And, you know, it's absolutely imperative that that happens in this country and around the world. And so I don't think anyone is suggesting, at least in countries where there are good regulatory requirements such as our own, that shortcuts should be taken that would in any way endanger people or their health. And so that is really important. Safety first under all circumstances.
Yeah. In general, how long does it take to develop a vaccine? I mean, a pretty simple question. I mean, just on average, is it difficult to tell, or is there, you know, something we can look back in history and say, well, you know, about a year, a couple of months, 2 years, what do we look at to get a proper vaccine going?
Certainly, I've never seen in history the speed that we've seen now with this COVID-19 to have got to this point where we've got phase 3s in place, when we literally knew the genotype only in January, is extraordinary. You know, it really is unbelievably quick. But if we look back in history, well, typhoid vaccine took about 30 to 35 years. We've been looking for an HIV vaccine for 35 years. On the other hand, you know, we had an Ebola vaccine in 2 to 3 years' time. So I think it depends a little bit on the pathogen, and a lot on luck. Obviously, if you're able to find the right antigen, it works. You can use it. That would be great. Again, what has been unprecedented on this occasion is just how industry has jumped in, and we have so many products, so many irons in the fire. I think the odds are really in our favor. But, you know, this is a process that we have to see how it plays out. Yeah. And hopefully we'll know in the next year whether we have a winner to take forward.
Yeah. Prof, let's talk a little bit about what developed this week in Russia, because we saw there that this, of course, the President Putin has gone and rubber-stamped this vaccine, and I mean, this is 2 months in the making, and is ready for a rollout of Russian citizens. I mean, what do you make of that?
I think that's a shortcut that's unacceptable, frankly. You know, I think when a vaccine is being tested under trial conditions, people are very carefully monitored. They understand the risks they're taking. There's the informed consent process. There is careful monitoring of their well-being, and there are obviously safeguards within that structured, limited experiment. Once you move to say, well, we're rolling this out in the public, that is a very different message. It says, we believe this works and we're doing this for your own well-being. And so trust us, go for it. Now, hopefully it's going to be okay. And maybe they do have a safe, efficacious vaccine and all will be well. However, if not, then, there are terrible potential harms that can be caused by this. And I think the risk that entails outweighs the benefit. And I think, that this is really in the 21st century not the way products should be carefully developed, taking into consideration ethics and general well-being in the public. This is not good scientific and ethical sort of production.
Yeah. As we said, or I mentioned a bit earlier, is the fact that it seems to be this global race, whether it comes from America and the President Donald Trump saying before the end of the year, we're going to have something, Russia starting to do production in 2 weeks' time, and, many other countries racing as well. One almost feels that it's more politics at play as opposed to science. I know it's quite a controversial thing to say, but it is something that we need to understand.
Yeah, I mean, I think this epidemic has been extraordinary for the tension between the politics and the science. I think we've seen that play out in all kinds of ways. I think, whilst the politics will happen and we need to put them on the side, we have to be clear this is a health-related matter. This is an infectious disease. And therefore, we need to tackle it with good science. First and foremost, good science.
Yeah.
Yes, I think we can find ways to expedite and, increase production the minute we have the right signals and we know we're in a safe space. So there are other ways, as I say, that we can increase the race and reduce the time.
Yeah.
But taking shortcuts is not really in the world's best interest.
Yeah, it certainly is dangerous. Just finally, as we wrap up the interview, Prof, you're watching the numbers, you're seeing the handling of it by South African officials. We're obviously seeing and expecting some form of announcement to come from the presidency in the next couple of days as to where South Africa is going to go, open up, all of these kind of things. I'm not going to ask you to speak on that, but what I am going to ask you is just your view and opinion as to how South Africa has handled the coronavirus issue in South Africa. We're seeing big numbers coming out. South Africa in the top 5, the death rate now at over 11,000. Are we satisfied? What have we done wrong or right here?
I think we've done our best. I think the extraordinary thing about this epidemic is just that we've been learning literally as we go. And so, in that unpredictable no information space, one has to a certain extent, look and see what's happening in the north and then try and figure out what needs to happen here. And clearly, the epidemic is behaving slightly different, somewhat differently in different parts of the world. Even in this country, we're seeing different trajectories in different provinces, and we don't fully understand why. So, it's difficult to program when you've got all those unknowns. I think we've done the best we could. I think it's important now to really continue those non-biomedical interventions, such as continuing to think about physical distancing, think about always wearing masks in public, being careful about gatherings indoors, so that we can continue to keep the lid on things whilst we wait for that vaccine. But, I can only say that I think in time we'll look back with the retrospectoscope and be able to really understand what was needed and what wasn't. But in the heat of the moment, I think we've done the best we could.
Yeah, I mean, it is, it's one of those unpredictable things where you just don't know. You really don't, and that's what I think what puts the fear in a lot of people is you may have a common cold and then the next second it's actually not a common cold, it's coronavirus. You may be feeling absolutely fine and you have coronavirus, or it may hit you in a way that lands you up in ICU on a ventilator. So there are still things that we're discovering about this. But the one thing that I imagine we're a bit further down the line now is looking at the after effects and the actual long-term effects of coronavirus. That's something I think we need to know a little bit more about. How are we doing on that front?
Well, I think there are two kinds of after effects. The one is the after effects of the lockdown and the closure of many aspects. I think we're going to have to see how that plays out. I think around the world, for example, other vaccination, childhood vaccination has taken a real dip. Are we going to see outbreaks of measles and, etc.? We know in this country, TB and HIV services have also been reduced. Are we going to see a surge in both of those epidemics? Of course, malnutrition and the economic, difficulties, all of that is going to play out, I think, in health, not only in economics down the line. And then, of course, there's the direct long-term effects of coronavirus in individuals. And, I think there's been quite a lot written about how there do seem to be some long-term effects in individuals. And again, this is a growing area of interest and discovery, this kind of post-viral syndrome where people struggle to regain their strength, get back to where they were, even younger people. So the virus has been very, multi-factorial in its impact, as you say, in individuals, and in its manifestation. So some people recover entirely immediately, and others are having this long-term impact. And then finally, those individuals who've obviously been in ICUs and on ventilators for a very long time, those individuals have to get back to their lives. And that can be a long and important rehabilitation. So yes, I think we still have months ahead of us in many ways, and so again, what we're trying to do, certainly within the work we do, is learn to live with COVID, work with it, bring it into our systems, make sure that we can continue to pay attention to other issues, the issues that have constantly been in the country, whilst adapting to this new era.
Professor, it's been a pleasure speaking to you. Thank you so much for your insight into everything around coronavirus, trying to educate the nation as much as we possibly can with professionals such as yourself. Professor Linda-Gail Bekker, she of course is the COO of the Desmond Tutu Health Foundation, and it's a pleasure again to have had you here.
Thank you for having me.
It's a pleasure. All right, that leads us up to 8:30 on the programme. Let's get our news headlines. Sakina has the details.